Welcome back to Unraveling the Brain. I'm your host, Dr. Josh Madsen. Today, we are going to be chatting with Matthew Klein, and he's a speech-language pathologist. And we're going to be talking about a lot about kids that are pre-verbal. They're not speaking. Maybe they have speech praxia. Maybe they have autism, and different things we can do to help reinforce some of that communication. And so I'm really excited for this conversation. I hope it helps a ton of you parents out there that are struggling with this, or maybe have a child that's pre-verbal. That maybe you'll get some tips that can be implemented to help them today. So let's jump into it. What's up?
How's it going?
Good. Thanks for being here.
Thank you for having me.
Well, let's get started with, we see a ton of kids in here that are pre-verbal or not talking, or after we work with them, they start communicating a little bit more. But those things kind of happen naturally as we work on development. But I really want to talk about maybe some different strategies that we can implement from a speech language pathology aspects, maybe some things that parents can do at home to help reinforce that communication ability, and not just the verbal, but the nonverbal, all those different things that we've been talking about throughout this week. So let's start with that. Let's start with here's a simple place to start, and maybe give a little bit of background of yourself, but then and your background in AAC devices, and then we can jump into some more complex topics here.
Yeah, so I have been working as a professional in speech language pathology for 5 years now. Prior to that, my education undergrad was at University of Northern Iowa, where I got my bachelor's in communication sciences and disorders, and then I pursued my master's at the University of Kansas. Between that time period there, one of the things that really drew me to the field and why I wanted to continue my master's was to really have the opportunity to provide children, adults, whoever it may be, with a voice, or at least help support them, helping them find their optimal mode of communication, is how I said it at that time. So at the University of Kansas, I had a great opportunity to get a lot of hands-on experience with augmentative and alternative communication, both high-tech and low-tech devices. And so that really kind of drove my passion. And then the past 5 years, I've worked in various school districts. And for 3 years in what you would consider a typical public school, both middle school and high school age students. And then also I helped out with as the district's AAC specialist, going to the early childhood program, and they had their SOPs there, but also helping support them in the programming and what they did with their students. And then the past 2 years, I worked in a school where majority of the students were autistic learners. And so that was a very unique opportunity to target and work on social language skills and really receptive and expressive language skills. So yeah, that's kind of my background, and now I'm here to share about some more
And
in-depth.
Matthew, for people who don't know, is he's going to be helping to start the clinic up in Minnesota, and that's going to have more of a speech background. We're going to have still a lot of the stuff that we do with our kids here, like these neuromotor developmental aspects, but up there, we're going to be incorporating a lot more speech development. So as kids start working through like this week, we've had a couple kids that when they came to us last time, they were pre-verbal. They weren't, we had a 3-year-old that wasn't speaking, the child diagnosed with autism. We had another, I think 5 or 6-year-old that wasn't speaking. Now they're starting to speak. And the goal is that we can help them get to that point here, but then we can send them up there, and now we can really start working on fostering that communication and development.
Exactly.
So I'm excited to talk about that. But let's talk about some things that parents don't think about on not even like what things that come before we ever speak. Like, because a lot of times, like a parent will be like, "Oh, I want him to speak. I want him to speak. I want him to speak." Well, there's a lot of systems. There's a lot of things that have to develop before that verbal communication can happen. So let's start there.
So there's a lot of pre-verbal things that you should be looking for. Um, in that first year of development is so critical. And, like you said, parents, they want their children to speak, but there are things that need to take place first, so that you should look for, and also if you're considering or thinking, is my child potentially delayed, things that you can look for.
Yeah.
A big one is response. So first, to responding to sounds. So
Yep.
if you think of, when I explain this, I like to think, like, put myself in the mindset of a parent, or if I'm with an infant or a child, what are the things that I normally see? Well, if I'm saying their voice, eventually they're going to start responding to your voice. There's that voice recognition, looking at you when you talk to them. So things like that. And then in addition to that, it's what's called joint attention. So not only are you do they recognize your voice, but they're looking at you,
Mhm.
acknowledging, and that with that joint attention, that's also acknowledging that there's another person there,
Yep.
which is a part. Yes, that's language, and that's also part of like the pragmatic language as well.
Yeah. And yet something interesting that goes off that is there's some different studies that I've looked at over the years of and learned about in some courses. It was really interesting. And one thing that was consistently noticed off this topic with kids that had developmental issues and specifically autism is that when they did studies to look, they used computerized eye tracking to see where their
Mhm,
eyes were looking, and what they found was super interesting was that with kids that had autism, they were looking at, like, the shoulders or the top of the head. They weren't actually looking at the mouth. They weren't
mhm.
looking at the eyes, where when you compared them to typical neurotypical developing children, they looked at their eyes, they looked at their mouth, and they looked for a lot of those nonverbal cues or
Mhm.
looked for where that sound was coming from so they could eventually mimic that, which is pretty interesting.
That is very interesting, and that's another point of some, like, a preverbal, are those gestures, and that does not just include when we think of a gesture of, like, pointing, but it's even, waving, nodding your head, yes, nodding your head, no, giving something, taking something, um so it's, 16 gestures by 16 months, so looking at that whole development,
Hmm,
that first 16 months of life. So, that also includes blowing a kiss, clapping, showing, "Hey, look, I have a toy." Even though they're not verbally expressing, "I have a car," if they have a car in their hand, they're showing you, that's a part of that, they're looking up at you, have that joint attention, and
yeah.
non-verbally communicating, that I have something.
Right, right, and when you look at the developmental, like, you look at the right side of the brain developing versus the left side of the brain developing. The right side of our brain is a lot of that like nonverbal communication. That's primarily maturing in that first like 18 months to 2 years when you get the biggest, when you look at right to left, more maturation in the right side. And then around that 18 months, we start getting more of the left side starting to activate. And that's where our verbal communication comes in. So it matches a lot of those things that you should start seeing around that time is because that nonverbal system really has to develop before the verbal system
Mhm.
develops. So if someone isn't doing these things, because 'cause I'm sure you guys learn all about this in speech therapy as well, but if a kid isn't doing these nonverbal things, what are like a few what are 3 things that a parent could do to get them to start using some of these nonverbal skills?
Mm. Well, there 3 things. There is an extensive list. Um, this one sounds really basic, but putting your device down
Mm,
and focusing on your child.
100%.
So, uh, I mean, that's not an attack on anyone. I do that too with my nieces and nephews. Sometimes I have my phone out when I'm
Yep,
around them. But, if you're focused on something that's in front of you temporarily, you're not focused on who's in front of you.
right.
And that, as an adult or a parent or um, a family member, that allows you to see, all right, what are they doing? What are they not doing?
Yeah,
So that's really what I would say first is to put the device down, designate times for play,
yep,
for reading. Um, Even if you're not uh like reading the text, they're a small child. When instead of like reading the text, you can do that, but talk about the book. So there's all these, like, when we think of like language development and what is language, you have both receptive and you have expressive language. So the receptive is the input, it's what we understand, what we take in. The expressive is the output. It's uh, using the vocabulary that we're learning.
yep,
So although a child is not able to express themselves,
yeah,
like if we're talking, especially birth to 3,
yeah,
where that language is developing, um, you still want to model and communicate and talk to them.
Yeah.
And so we know too that receptive language develops before expressive language.
Yeah.
And so by implementing different strategies to get more specific with your question, one of the biggest things is modeling. And
Yep.
so I'll talk, if we get into it with augmentative alternative communication, I'll talk about that later. But modeling is pretty self explanatory, but it's using the language that you want them to use.
Yeah.
Um, so there's that aspect of it, or a strategy. Um,
Let's just talk about modeling right now
yeah.
because I mean it's fits so perfectly in here of, like developing communication is get rid of your phone. What can we model now? Like what can we start
Mhm.
like let's say we want to start, working on and I don't even know the first words that you'd want to work on in the sequence of words, but whatever the first most common words used are, which you would know what those are, I don't. But how do we model that? Like what does that mean to just a parent? How would
Mm.
you explain that to a parent?
So modeling that, if we're talking very at the basic, I think before maybe getting into that, like looking at some of the developmental norms, what you should be expecting
Yeah.
from your child, you know, the from birth to 3, you have cooing. So ooh, ah, mm. So the child's starting to use their mouth and
Yep.
explore there. So even in that case, modeling that, if you're playing
Right.
just modeling, bringing the lips together, playing with the mouth, then we get into more vocalizations of the ah, like the vowelization, but maybe with a consonant attached to that. So maybe da is attached to there. So you're starting to bring the consonants together.
Yep. So modeling those simple
Modeling,
sounds for
modeling those.
and
Then
we'll
is
we'll put this list also for you guys. We'll put this list of like what are the normal developmental, things they should be doing at certain times. That way if you do have a child that's an infant, here's things that you can model for them.
mhm,
Yeah.
yes.
Like so simple words like different things that should be, in those first kind of few months, but then as they get a little bit older, but like we can even talk about that of let's say you have a child that is developmentally delayed and they're 3 years old. Well, if they've never made these sounds, like, is it appropriate to start at those sounds to develop that communication system
Mm.
or not?
Yeah. I mean, I would say I would say yes. You're still modeling the language and the um the sounds that you're targeting.
The actual motor playing
Yeah,
of
the
those,
motor
huh?
thing, you're modeling that, and, typically then that joint attention, there's a chance with that joint attention not being there,
Yep,
like, that's
for sure.
potentially delayed, but again, uh, the receptive language, even if there's a delay, uh, there's still, unless there's a hearing loss or anything like that, that might impact what they hear, there's still input coming into their system, in
For
their
sure.
brain.
I feel like as we've worked with a lot of these kids and they start communicating more efficiently, it's amazing how much is actually in there that's just it's locked in there. Like they can't get it out because
Mhm.
they can't express that, but they understand an unreal amount. It's kind
Yeah,
of wild.
it is, and that's something, just as I've been a professional, presume competence, don't assume incompetence.
Yeah.
And so that's both with, I mean, that's receptive expressive language, that's with using a device, whatever it may be. Um, so that's something that I really like to abide by or strive to.
Yeah.
And I would not just as a professional, but as a family member, that's, there is something, even if there's a your child is delayed, there is something in their brain, that or something that they want to communicate, and that's what an SLP can help with, or
Right.
hopefully is to kind of unlock that and like I mentioned before, find that optimal mode, to help them express themselves at
Yeah.
whatever stage they are developmentally.
Yeah,
Yeah.
yeah, and, going to modeling and going to augmented communication and talking about that a little bit, let's talk about AAC devices because what I've came to understand through our conversations and through stuff is a lot of times it's used improperly, number 1. Number 2, there's no training on it, so a parent doesn't know how to use it, they don't know how to model with it, they
Mhm.
don't know how to act even if an SLP does give them to them, sometimes the SLP doesn't know that, and a lot of times kids come in here and they already have devices, but they've never like, they don't bring them with them.
Yep.
They don't know really how to use them. So let's talk about that. Let's talk about how we can do some, we can use augmented communication and why it's valuable.
Yes.
Let's do
Yes.
that.
So, augmentative and alternative communication. I think one of the biggest things to recognize with that is it's not just. I would say a common misconception, maybe I should say, is that the device or software, or even if it's a low tech core board, that's going to hinder or take away a child's ability to verbally communicate or verbally express himself. And that's not the case. Research actually it shows the opposite, that using a device enhances a child's opportunity to speak as well.
Yeah.
That doesn't mean every single child is gonna use a device and go solely to speaking. However, it is a form of communication and a form of language. And so right there, what I said, I think it's a big mindset piece,
Yeah.
both for families, for people or teachers in education, is that if a child, if your child or someone in your school, or even someone that you see in the community has a communication device, that is a form of language. It's not just a piece of technology.
Right.
Because I think if you see it as a language, it's like, okay, now it's not just like an iPad that they can play with and hit a word. Like, this is their way that at this time is their most effective way to communicate.
Right.
In grad school and even beyond, like, some professors talked, you give a if you gave someone a Spanish dictionary or a dictionary in a different language and said, "Okay, here it is. Now speak to me in that language." You're not gonna be able to unless you're really
Yeah.
smart,
You're not gonna use it at all.
you're not gonna be able to use it. Or, "Here's a piano, play." And someone they might poke around, but they're not fluent in that. So that's where same thing with, like, a device. I think often what happens is, "All right, here's the device. Now they should use it."
Yeah.
But
No one ever taught them how to
no one
use
ever
it
taught them how to
in
do
the
it.
right order.
Exactly, and that's where that mindset comes into play of a language, because if you take that and you think of a typically developing child who's able to verbally speak and has no issues with that, think of how often you as an adult or parent are modeling to them.
Yeah.
Even if they're not, like, attending to you. You might be in the kitchen doing something and you see them, maybe roll over, "Oh, oh, Sam, you rolled over. Like, I like how you rolled over. That's so cool." And you give positive praise. Your intonation raises up, which positive praise is great. And having the variation in pitch and tone is very important for
Yeah.
development as well. I or not, if someone asks, like, I think that is just a big mindset to have
Right.
blanket, like, like, first thing first.
For sure. And like to go off of that, I think it's important for people to understand of like even though they're not speaking, they're still activating the network, which is
Mhm.
super important because like there's studies out there where people they physically play the piano for a period of like it was like 6 or 8 weeks when I was reading. I can remember they physically played the piano, a piece of music, right? And then there was another group that didn't touch a piano. They thought about it over and over in their head, and they
Mhm.
practiced it in their head, and for the same amount of period, same amount of time, like an hour a day. And what happened was the person that played the piano, they played it slightly better than the people that didn't play the piano at all when they actually but they went to go play the piano, and the group that didn't play it, they could still play the music, but they never touched the piano. If you gave that same person that practice it in their mind over and over and over again, like, it was, like, something like a couple of hours to practice it on the physical piano, they could play it just as well as the person that physically played the piano
Mm.
every single day for an hour.
Mhm.
And it just shows the importance of using like, when they do that, like, "I want this," they're practicing in their head, "I want this." Like, they're getting
Yes.
that over and over and over again, even though maybe they can't get the words out yet, they're activating the networks over and
Yes.
over, which is huge for development.
Yes, it is. And that's I mean, it's gonna sound redundant, but literally every time I, like, talk with parents about this, I'm like, "Model, model, model." Even that, like, that receptive input of hearing maybe a parent or someone, modeling, "I want," or making a comment like, "Oh, I like this show. This ice cream's good." If they hear that, like, that's coming into their brain and that vocabulary, and then that's where, teaching the usage of an alternative form, uh, comes into play and really beneficial.
Yeah.
Um
And then on top of that, like, I think about it of we work so much on like these motor systems to develop, and these motor
Mhm.
systems are foundational for our speech motor systems. And that's why we see kids start to speak more as we start working on these systems. But if they already had a solid communication, like built already, like they know how to use words, like it's in their head, they already know all these different terms and words because they've been actively working on that
Yes.
communication. Well, now they already have that whole foundation built. The once they get that motor system, boom, now it can
Yes.
really turn on. So,
Exactly. Exactly. And that's, I mean, that's the exciting part with the work that's being done at
yeah,
Infinity is you are seeing as you're working on um targeting those speech areas and making those connections stronger. Like you're seeing and parents are talking about that their childs are verbalizing more or speaking more or making more like even if it's at the individual sound level with their mouth. And
yeah,
that's like huge. So you're right. If you also, even before that, you're teaching this mode of language and an out mode of output
yeah,
along with your verbal expression, because you don't wanna forget about that either.
right.
Like you said, once that's tapped in and what you're doing or what's happening here at Infinity, and then combining that, like, hopefully that can,
Create a
create a
much larger success for
yes,
'em. Yeah.
exactly.
Um, let's let's maybe put this to rest with because we have so many that come in and say, "Oh yeah, we tried using the speech device and it didn't work," and this and that. What are some maybe a few things that um, unless there's someone that specializes in AAC like you and have done that extra training and all that extra learning and focus, and maybe they just got it from like their normal SLP or
Mhm.
something along those lines. What are some maybe some I don't know, misnomers or misconceptions that maybe just weren't put out there right, or maybe some things that they could work on to make that a more usable device for their kid?
Yeah. Yeah, I mean, there's quite a bit out there that they can do. I mean, misconceptions. Um, there's, they're not old enough to they're not old enough to use the device. Uh, well, they may not be old enough. However, where the basis foundation of this is we're not necessarily expecting them to use it, just like we don't like a typically developing child, there is development to get to the point of speaking. Um, so that's a misconception. You
Right.
can literally start it at, I mean, maybe not right at, well, you could,
Yeah.
if you could start this right at birth and even if you model like 2 words a day, but
Same thing with sign language. Like, I
exactly,
mean, kids know how to use
exactly,
more in at
exactly.
a really early age.
Yeah.
So, but
So that's a misconception. Like part of me is like, for a parent where it is overwhelming, like you want to be able, like, you can literally like just pick one word for the week and start with that.
yeah.
Like because it
Oh
can
yeah.
be very overwhelming.
Yeah, for sure.
So with a device or an AAC system, whether it's high tech or low tech, um, I guess where would I show this? Here?
Yeah.
Okay. So there's different types of boards out there. There's different programs. There's different softwares. This one is from Universal Core. And so as you can see, this is a grid size 6 across and 6 down. So right here, what you see is there's what we call core vocabulary. Core vocabulary is 80% of the words that we use in our speech. So if you were to take a language sample of what you talked for in 10 minutes, time, there'd be a good chance that around 80% would be this core vocabulary. And then those other 20% of words, that's what we call fringe vocabulary. That's kind of like the glue that attaches the core words together.
Yep.
So uh, with that, if you're given a device or if you're given a core board, whether in school, your SLP gives it to you, a very simple strategy and help for families uh, is really like focus on one word, maybe two or three, depending on like your comfortability.
Yeah. Like
So
in a day or a week
in
period or
a
something.
in a week, and if like I would say like start with a week, and if your kid is like really picking up on it, okay, then move forward, like add
Yeah.
another one. Um, and like, so what I did today, and I mean, show this very simply, is today I wanted to focus on like, look, and on and up. So I know that's four, but all I did is I just highlighted it. It's a black
Yeah.
marker, not the best, but I highlighted it. Another thing some people do is black everything else out.
Yeah.
So, that way visually for both for the adult who's helping model and use this and teach it, it kind of helps them in the process, and it also helps the child like, okay, I don't need to go searching right now. I can touch like.
Yeah.
Same type of feature can be found on an actual system. So, this is where collaboration with the speech language pathologist really should come into play. Um, is that there's hiding features. So if you don't want to, obviously we want to give a robust language, but we also have to consider developmentally where is the child at.
Yeah, what are they looking for?
Yes. And um, you know, there's there is there's different opinions on grid size. So I mentioned on this one, the grid size that was 6 by 6. There's grid sizes that you can have 4 on a page. You can have 8. You can have 36 and up to like over 100. Um, my personal opinion, you want to give a larger grid size so that it gives a more robust vocabulary for that child. And then you can set that grid size so they learn like where the icons are at, but then you can hide the icons. So again, if you're wanting to focus on 2 or 3 words, like core words, and not really going into categories or groups, like you can go into food or school or geography, you can hide that
Yeah,
and just focus on those core words at that time. So again, you know, for myself as an SLP professional, I very much acknowledge and recognize this is like it is overwhelming for a family that's just getting this,
for sure.
but there are ways to help, maybe take away some of that anxiety or like stress around it, and like what am I supposed to do, and to really like streamline their understanding and learning of it.
Right,
Yeah.
for sure. And then, let's say as a parent starts to develop this and they start to, the kid starts to develop a communication, they start being able to
Hmm.
communicate, which honestly, I mean, I know there's a lot of information on this as well of like improving behavioral issues and just because they
Hmm.
can communicate their needs and wants. But as they learn how to do that, then how does an SLP come in and help with like starting to create some of that verbal communication?
Yeah, I mean, it kind of goes it's all like kind of how I view it is kind of all hand in hand. Um, because while you're using a device, you're not verbally communicating.
Correct.
A part of your model is um you're both I mean there's quite a few strategies that go along with it, but you're providing aided language input. So there's a great visual that is, if you so input being what you take in. So if you're the non-speaker, nonverbal individual, and I'm just modeling to you my verbal speech, you're taking it in, but there's a disconnect of being able to express that.
Yep.
Um, but if we're providing the aided language, which is the device or the board, and giving that visual, modeling there, modeling here, you're teaching both the speaking and the technology, and then that gives an individual their output can be either,
Right.
So that's kind of I guess I wouldn't say there's like one specific way, but you're doing like they tell speech language pathologists, our intervention with a device or with a core board, it's the same as typical language or speech intervention. You're just you're supplementing an additional
Visual aspect.
visual aspect for them. And then, you know, it is kind like it's what works best for that child.
Yeah.
There are adults, I've listened to some podcasts of, autistic adults who, they are primarily speaking, but there's sometimes where they feel maybe more anxious or, um more, like, uncomfortable, and so they choose to use their device in those situations.
Yeah.
So it could be flipped, It could be maybe a child is more comfortable using the device most of the time, but, maybe with their family, they choose to speak.
Right.
Um, so I guess I don't know if there's a specific, like, I think like we said, a parent wants their child child to speak,
Right.
and I totally get that. Um, what we're doing here is providing a tool for them to communicate.
Yep.
So, research does show that using both mode or using this mode does enhance and the opportunity to or enhance the skill set to use your
Speak.
use your verbal communication. Um, but there's also no way in knowing 100% that a child is going to grow into
For
being
sure.
a speaking child versus like using a device.
For sure. And, I talk about that a lot. And like with when we look at like neurodevelopment and we look at kids that, that have developmental delays, like sometimes we have 7 layers of our brain, and these neurons, like in an infancy, what happens is they start migrating to those higher cortical layers. Well, and some kids that have autism, for example, certain areas of their brain don't have those neurons in those cortical layers. So, like, for example, let's say that's in their broca's speech
Mhm.
area, they may not have neurons in that cortical area appropriate or the density needed to produce verbal speech.
Mhm.
Like, so they may never speak,
Yeah.
but there's other kids that have them there, and we get more activity there, and they start to verbalize and they start to communicate more efficiently. But that's a very well known,
Mhm.
uh, with lots of research behind that, is that these neurons just do not migrate appropriately to those higher cortical layers,
Mhm.
to develop some of those skills. So,
Mhm.
but that doesn't mean that they still can't communicate in other ways.
Exactly.
And if you can get them a way to actually share their voice and their knowledge, um, it's life changing for them.
It is. It's so powerful and uh yeah, until you like see that happen or whether you're a professional, whether you're in the schools, whether you're a family member, a parent, like actually seeing that it's absolutely like it's just amazing. And like I kind
Well,
of
perfect example today is that little kid you're working with where you modeled, then he did it, then he smiled.
yes.
And like that's him showing joy that, hey, this person actually understood what I was just saying.
Yes.
Like huge.
Exactly. You're unlocking this like it's like having duct tape, if you put
Yeah.
duct tape over your mouth and you wanna say, "I'm asking you questions, I'm talking to you," and you wanna respond, it's in there, but once you take off that duct tape, then you can communicate. That's
Yeah.
like what a device or core board or, AAC it's giving that mode, which kind of goes back to what I mentioned, like, from undergrad to grad, that was like I was like, "This is helping other individuals find their optimal mode of communication," and that's another thing too, because it is I want my child, I want my student to speak. This is maybe it's like at this given time, this is the most optimal mode for them to
For
communicate.
sure.
That may not be the same in 2 years, 5 years, but we need to work with what we know now of their skill set. What other therapies are they receiving that can maybe help that,
Yeah.
um, help boost that?
Yeah. I mean, the same thing, like, sometimes we send kids that have a convergence issue with their eyes. They can't bring their eyes in. We send them
Mhm.
to an eye doctor that puts them temporarily in some glasses with little prisms in them to push their eyes in, to take some stress off their eyes until those muscles develop,
Yeah,
until we get that, till vision therapy and whatnot gets their eyes strong enough. But then eventually they don't need those glasses
yeah.
anymore. They don't need
Mm.
that extra support anymore because now the system's developed.
Mhm.
And sometimes they just need that time.
Yeah.
So, to integrate that and develop it. Let's stop here today. The, closing remarks, Matt is gonna be one of the speech therapists up in Minnesota, with another doctor of chiropractic, and as we had therapists and stuff like that. But if you have any questions on AAC devices or how you can implement this or anything like that, just let us know. Reach out to us. We'll make a form, Monday.com form. Just put speech in the comments if you're interested in working on this skill or you need some help there, and that way we can build um, a list that we can go ahead and contact, to set up a consultation for that, and just let us know if you need help. It's something that we would love to do, and go from there. Any closing comments?
Exactly what you said. If there is potentially a need or there you just want more information or interested, definitely comment. And that's something, you know, what's beautiful about the clinic here is you have chiropractic, you have the functional neurology, you have PT, OT. Um, there there is a need with the speech and language aspect, and that's what we're excited to bring to Minneapolis as well.
Yeah.
Um, and so, I think closing remarks as a whole, there's a lot of information that we talked about here. And as I mentioned throughout the whole part, this or the whole podcast, it can be overwhelming. Uh, and some parents yesterday expressed, you find out your child's delayed or maybe they're not speaking and you kind of just feel alone. But there are an abundance of professionals everywhere, but I'll speak for
Yeah.
Infinity. At Infinity, there's abundance of professionals that are wanting to help your child develop and succeed and grow. So,
Yeah, for sure.
um,
And that if you go to minnesotainfinity.com, there will also be a link on there so you guys can
mhm,
fill out a form there too. So that's a new website. Should be up by the time this podcast is out.
hopefully.
So yeah, hopefully. All right, everyone. Well, it's so great having you. If you guys need anything, please let us know. And we look forward to hearing from you. And if we don't hear from you, I hope this helps you out in some way or another. Have an awesome day.